welcome everyone. I know some of you joined a little bit late during the opening ceremony, and I hope you all enjoyed the words from Elder Diane just as much as I did. What a great way to set the stage for our time together today. So I will start with some key updates, but just to note that I don't want to spend too much time today because I want to hear from our speakers, which are just fantastic, and so excited to learn from everyone here today. But in the interim, I will I'll take some time to say a few key updates. And also to say that we may not have some time for questions, but you can feel free to write your questions in the chat, and we will prepare a question and answer package afterwards for everyone that we'll send to everyone. So we may not have time for a lot of questions just because we have so much great material to get through today. So with that, we can move to the next slide, Sharmila. Great. So for those of you who are new, just to remind you who we are. So we are a Canada-wide partnership between researchers, patients, and the public, healthcare providers, and health system decision makers. And in the preliminary talk today that we had with Elder Diane before before we started here with everyone today, we were talking about how a major goal of the SPORE Evidence Alliance is to bring the patient voice or the voice from the community to as close as possible to policy decision making. So that's a huge thing, and that's embedded in everything that we do. So we are trying to promote a Canadian health system increasingly informed and continuously improved using scientific evidence. So everything that we do is guided by evidence-informed methods to ensure high standards. And excuse me, we try to promote a research environment that focuses on key objectives such as, or core principles, mind you, such as inclusiveness, respect, and collaboration. And our research is conducted with decision makers. So we try to use an integrated knowledge translation approach where everyone is welcomed and joins as team members. And this would include patient and public partners, as well as healthcare providers and policymakers. So we're trying to include everyone who would be using and impacting, who would be impacted by our findings. So our key activities include our research query services. So we have 35 plus teams across Canada that have diverse expertise to respond to decision maker research needs. We provide training and skills development and also ideas and innovation. So our core activities, as per the mandate from the Canadian Institutes of Health Research, or CIHR, is to conduct knowledge synthesis, clinical practice guidelines, as well as knowledge translation. So as mentioned, we have multiple teams across Canada. So we have about 425 members. So 57 patient and public partners, 65 policy or health system managers, about 80 trainees, and then 223 researchers. And we do try to maintain geographic distribution across Canada. Also to note, we do have some international partnerships as well. So here is a nice visual of some of the people that are leading our work across the country, and many of you are here today, so thank you for joining, and thank you again for all of your support. So just to show that our model is really, we do try to have a pan-Canadian model where we have different teams as well as researchers, trainees, patient and public partners, and knowledge users across Canada, and we try to ensure that questions are being addressed across Canada. And also the teams that are conducting the work would be receiving the funding. So the funding would flow from us to all of those teams that are doing the really important work. So now I'll give a quick update on our research query services. So we have, since 2018, so we launched our query service request in April of 2018. So since then, we've had 278 requests accepted from 53 different organizations, nationally and internationally. So here we see where those queries came from. So the majority were from policy decision makers. However, a high proportion were also from health system managers, healthcare providers, other knowledge users. And then we do have a mechanism for patient and public partners or from communities to submit topics, which we'll get into in a few slides. So across the 278 queries, we've covered a range of different decisions. So anything from public health measures to health system arrangements, knowledge exchange and mobilization, economic and social response, as well as public and organizational policies. So even getting into legal and administrative questions. And from this work, we've produced 283 technical reports, 79 peer-reviewed publications, 64 oral presentations, and 105 other products. So we have had some repeat services from different organizations. So we do tend to try to spread our projects around so that we're not responding to solely one organization. But that being said, we have had some repeat work from various organizations. So anywhere ranging from Unity Health Toronto locally, all the way to provincially with the Government of Northwest Territories, all the way to nationally with Health Canada, and then internationally with the World Health Organization. So we do have a series of templates and guidance for all of our research teams. So we do try to standardize what we do and provide as much support as we can to everyone. So please follow the link if you're interested to see those resources, and we're always continuously adding to those resources. So please do feel free to visit that as time goes on. So just to talk about some of our impact and just to highlight some of the amazing, incredible work of the team. So this really is a community, a team effort. And I have the privilege and honor to be able to work alongside many of you here today. So it just really is an honor for me to support your work and provide anything that I can do to progress with the work, as well as showcase the important work that you're doing. So for example, co-principal investigator, Dr. Curran, she did a project on the maternal and neonatal health, and this was commissioned by the WHO, and it was found to be impacting more than 140 million births per year. So this is a very important project, and their work and their names are actually cited in that WHO guidance that is used by people internationally. So this was one that I had the privilege of leading, which was on gaming disorder for the WHO, and this was actually helping them with their ICD codes, impacting approximately 60 million people internationally. And then another one that we did, we wanted to highlight this one because it was the first guideline about long-term care when we're looking at infection prevention and control. And this again was commissioned by the WHO. And this was used by many different organizations, such as the Canadian Frailty Network, as well as the Organization for Economic and Cooperation Development Policy, the Irish Department of Health, as well as the Australian Department of Health. Also wanted to talk about some of our guidelines work. So Julian Little, a co-investigator on the SPORE Evidence Alliance, he did a whole project on the risk assessment for COVID, and this was for the Irish Department of Health. Also, I want to highlight the fantastic work by Dr. Deepa Singhal, who's a co-investigator on the SPORE Evidence Alliance and looking at the global policy analysis of autism strategies. And this really is a collaboration of people in Canada and internationally. So many different organizations, such as the Public Health Agency of Canada, Autism Europe, and many more. Also, previous co-principal investigator, Purtis Moffat, she led a very important project on family violence interventions, and this was commissioned by the government of the Northwest Territories. She did some fantastic learning circles with Indigenous people living in the area, and this was related to 15,000 households in the Northwest Territories. Also want to highlight the important work by Dr. Jennifer Walker, who is also a co-investigator, looking at Indigenous colorectal screening programs, and this was commissioned by the Sioux Lookout First Nations Health Authority, and this was actually being implemented among 33 First Nations communities. Also, co-investigator Dr. Hamilton, I'm not sure if he's on the line today, but want to also highlight the important project he did. This was commissioned by Unity Health Toronto, and this was looking at workplace violence in the emergency departments. So hopefully some of these stories that we're sharing shows you the breadth of the impact as well as the diversity in research topics and some of the teams across the country that are doing this important work. So I won't read all of these quotes, but just to say that many of the different organizations that we've worked with have been incredibly pleased with the projects that we've provided for them. So everything that you're doing is having a huge impact. So for example, Dr. Langlois with the WHO was talking about a program, a capacity building program that we provided for rapid review platforms in low and middle income countries. And this really equipped them to respond to numerous policymaker requests for rapid evidence synthesis during COVID, as an example. And then another one here from the government of the Northwest Territories was saying that the collaboration moved their work one step further. It validated the research and also wanted to recognize the care of the team, that they not only met their ethical obligations, but they also carefully managed interaction with community members in a very culturally safe way and putting the needs of community participants ahead of all of their research goals. So really, again, showing the impact and showing not only that the rigorous methods that are being used, but also that this is being done very carefully and making sure that we uphold the highest ethical as well as community and cultural safety standards. So we've also made some methods advancements. And so some of our work that we've been doing in terms, especially in regards to rapid reviews. So this was cited by the Robert Koch Institute in Germany, as well as the Australian Living Guidelines. And also we were asked to speak with the Brazilian Ministry of Health, as well as the National Health Services of the UK and the International Public Policy Observatory because of the rapid response services that we've provided. And we've also provided webinars and workshops for Public Health Agency of Canada and Health Canada based on the methods and all of the learnings that we have done with all of the work through the SPOR Evidence Alliance. So in terms of our decision maker query process, so we encourage decision-making organizations to submit their queries using a very simple online form. So definitely you can look at this at our website, you will see that. And then what we do is we would match them up with the research team and we would provide support to those research team through many different ways. And then making sure that everything that we do is tailored to those policy decision makers to make sure that their requests are completed on time. And also on every team, we try to ensure that we have patient and public partners engaged, as well as healthcare providers or clinical topic experts on those projects. And we also try to make sure that we have trainees on every project as well. So getting to our training and capacity development updates. So we have been able to provide 270 learning opportunities, and we have engaged with 4,920 learners, including almost 1,000 knowledge users. 61 of our research queries were led by 24 early career researchers, so we strongly believe in supporting and providing mentorship to the next generation of scientists. We've had 256 trainees engaged across almost 100 queries, and we have had 46 patient and public partners that were trained. These were provided by 2 courses that were co-led by Janet Gunderson as well as Maureen Smith. So huge shout out to them as well, who co-led these patient and public partner courses. And then all of those individuals were actually engaged in projects. And I think I get into that in a few slides. And then also we'll highlight the trainees and early career researchers that we provided seed funding to advance projects with a methodological focus on them. So here's the seed grant. So we provide $10,000 per award, and we have different themes every year. So one year was looking at patient engagement, the next year was looking at guidelines, and then the final year was looking at patient partnership and knowledge dissemination using an equity, diversity, inclusion, and social justice lens. And just to let everyone know, give you advance notice that the 2024 seed grant will be looking at advancing Indigenous ways of knowing and doing research. So definitely keep yourself posted on this, and that we will be providing some advertising on that in the new year. So I want to highlight the fantastic work of the SEED grant winners over the years. So these individuals have been working on a lot of very interesting topics. So for example, looking at trauma-informed intersection of diabetes during COVID, looking at community partnership of chronic pain, also looking through how multiple perspectives of patients can be used when we're looking at AI health research, as well as thinking about gender diverse people in clinical practice guidelines, thinking about patients and public partners in the James Lind Alliance priority approach, looking at the predictors of women's health satisfaction in their HIV care, as well as engaging Métis citizens in child health resources, and looking at in-hospital physical activity programming. So we can see here again the breadth of all the different topics and the depth of the topics of the SEED grant winners. So we've also hosted 11 clinical research trainees on knowledge synthesis projects. So they help with all aspects of the knowledge synthesis and they become co-authors on those projects. So we've personally mentored 11 clinician research trainees. So we also want to shout out Dr. Janet Curran and Dr. Jennifer Watt and Dr. Julian Little for helping providing mentorship to some of these clinical fellows as well. And you will see through their review titles that again, they have helped with a lot of different projects. So in terms of patient engagement, so we have had our 2 patient-led courses, and we also have 2 patient engagement evaluation papers. So one was led by Dr. Linda Lee, who I saw here earlier, as well as Dr. Cleon Hamilton. Those have been published in the Facets Journal, as well as the Journal of Clinical Epidemiology. So please definitely take a look at that. We have 4 principal knowledge users who are patient and public partners, as well as 14 additional knowledge users. 13 patient and public members sit on our governance structures, and we have 4 that are served as co-chairs. We also have our patient and public partner co-led projects. So these were prioritized projects. So we have 23 of those. And we also have 24 patient and public peer reviewers for our annual SEED grants, as well as our priority setting panels. 338 patient and public partner engagements across 100 research projects, and then quite a few, several hundred patient and public learners have participated in our capacity building events. So just want to touch on our patient and public topic priority setting. So for our 2023 round, we did receive 87 submissions with 63 unique topics, and this was both in English and French. And then we had a 15-member panel, and they selected the top 20 topics using a modified James Lind Alliance priority setting approach. And these top 20 projects are currently being funded by the SPOR Evidence Alliance, and they will be co-led by the patient or public partner who came up with the idea for this. And then we're also providing not only the patient and public partners, but also the teams with capacity building resources and guidance. So stay tuned for that. We haven't finalized everything yet in terms of matching up the topics and the teams, but several of the teams will be contacted soon. And also to say that we are trying to spread those around, so trying to give as many teams a chance to do this really, really incredible work. So just in terms of the impact, so just some nice quotes here from some of those patient co-led projects. So someone mentioned that the patient partners add heart and soul to the project, that it personalizes and humanizes the research process, and also that it challenges the research code book and encourages collaborative learning. So not only are we, as a SPOR Evidence Alliance, we're more interested in having an impact than going out and getting a peer-reviewed publication. So of course, we think publications are important. We're funded by CIHR, but really at the end of the day, the focus really is on engagement and making sure that we have a really collaborative learning environment and mutual respect where patients and the researchers and all the other knowledge users are included equally on the team as equal members. So our 2 patient-led courses, so again, we mentioned this again, and a huge shout out to Janet Gunderson and Maureen Smith again. And these graduates have actually collaborated in 33 plus demand-driven research projects. So not only did they get the training, but they actually got to go on and get some hands-on experience. And we also encourage them to be co-authors. And in most cases, they do contribute enough intellectually for them to be co-authors on all of those projects. So just to talk a little of the demographics. So as is common in Canada, the majority have been women compared to men who have taken the courses, but we're trying to encourage more men to engage as well. And just to show that we are trying to have geographic representation across Canada. In terms of understanding the course concepts, so for the first year in 2021, 96% reported greater understanding of the different material after taking the course. And then for the 22 course, 84% that they had reported having a greater understanding. So which is really, really great to see that we were able to help them with knowledge synthesis and the understanding of that. And then they're able to go on and engage and help with those different projects that we do. So a few administrative updates. So we have updated our conflicts of interest disclosure policy. So we wanted to be more inclusive and accessible, and we wanted to incorporate a social justice, equity, diversity, and inclusion plus lens to provide clarity and guidance to our end users around conflicts of interest reporting, and also including different examples. So we had some feedback that our conflict of interest policy, the previous version, it didn't help with different knowledge users, and it didn't help with different types of situations. So we had to provide some clarification on that. So this is something that we've done, again, very much a team effort and very much a way where we have included patient and public partners and researchers and trainees and other types of knowledge users in this conflicts of interest reporting. So that will be released, I believe, in the new year. Or sorry, that has already been released. Is that right, Wasifa? That's been released. Yes, sorry. Okay, great. And just in terms of some feedback, so just to share some quotes with you. So for example, from Maureen Smith, she said, "I really like the reflective questions. I often struggle with filling out these forms, and great to have everything defined so clearly." And then also for Allison Hones, who said, "Kudos to the leadership of the SPOR Evidence Alliance. It provides the foundation of transparent processes to identify and address real potential and perceived COIs." And then Lisa Dolovich, who's a researcher and the Dean of Pharmacy at the University of Toronto, she said COI policy is impressive and appreciated reading it and seeing the well thought out considerations. So great to see that people have been enjoying using the COI policy. And again, if you're part of other organizations and other initiatives, please feel free to borrow it, and we would be happy for you to use it in different situations as well. So we had our renewal. So this was 2-year directed funding opportunity. We submitted our application on October 3rd. We'll find out December 19th, fingers crossed. We welcomed some new members. So we had Dr. Angela Mashford-Pringle, who you'll be hearing from in a little bit. So she was nominated as a co-principal investigator, as well as Dr. Christine Fahim, Dr. Christine Cassidy, and Dr. Catherine Sibley. I see many of you here today, so thank you so much. We also have a co-principal knowledge user, Bev Pomeroy, who's also fantastic, and I know many of you work with her as well. So our Indigenous Research Champion is Dr. Angela Mashford-Pringle. Our section gender-based analyses chairs are Dr. Nicole Doria and Dr. Catherine Sibley, as well as our equity, diversity, and inclusion chairs are Beverly Pomeroy, Huda Shah, Dr. Shamara Baydembozo, as well as Dr. Cleon Hamilton. So huge thank you to everyone for your support. I know all of you provided a lot of help, whether it was through letters of support, coming up with matched contributions, or helping us think things through. So just again, want to thank everyone for helping with that grant proposal submission, and we will find out in December, fingers crossed, if we receive the funding or not. So if you've seen the grant, and happy to share it if you have not, but just to say that we have many different objectives that are building on the strong foundation of what we've been doing on. So again, our strong focus on sex and gender-based analysis, as well as equity, diversity, and inclusion. Also thinking about community-centered approaches and facilitating 20 projects coming from communities experiencing health inequities. Supporting the Indigenous community, so talking circles on data sovereignty principles, for example, that Dr. Mashford-Pringle will be leading. Also funding Indigenous-led methods projects through our SEED grant. amplifying our French language services. So we'll be working with Dr. Annie Leblanc and others on that, as well as completing 20 new knowledge user-driven research queries and creating at least 80 knowledge products from all of our work, establishing linkages where gaps exist across Canada, and then offering a number of new training events and providing new learners with opportunities to engage with us as well as different knowledge users. So we are doing a formal evaluation, and this is being conducted by Spindle Strategy Corporation. So they have an evaluation design phase as well as a data gathering phase, and then data analysis and reporting phase. And right now they are doing their data gathering. So they have conducted 19 key informant interviews, as well as 5 key informant focus groups with 37 participants. So you can see here the breakdown of the different survey respondents as well. So they've done interviews, focus groups, and an online survey. And so we had 123 participants in the online survey as well. So we are currently working with them, and they are currently about to finish up their gathering phase, and then we'll be moving on to the data analysis phase. And we hope to have some results for you early in 2024. Also, just to mention that SPORE itself, so the big SPORE is having a refresh. So they are trying to define a renewed approach, and they want to build on the successes to date. So if you go to the next slide, some of their key themes include the strengths and challenges for their program overall, important trends and emerging needs of the future, a real focus on delivering on Truth and Reconciliation Commission calls to action. Also strengthening equity, diversity, inclusion, anti-racism and accessibility, and patient engagement and patient-oriented research, and building capacity and partnership for excellence in patient-oriented research, as well as strengthening collaboration with policy and health system decision makers, and strengthening their governance. So just to note for everyone here to know that we will be reaching out to several of you in early 2024 because they would like us to provide some input into their SPORE refresh. So they provided some materials to share with you, and we would look forward to gathering your insight and your feedback on their refresh, their themes that they've come up with. So just as a little reminder of upcoming events and engagements, so the SPORE Refresh engagement will be happening in the first quarter of 2024. We're updating our patient appreciation policy. That's going to be in the first quarter of 2024 as well. Our SEED grant will be held in the summer of 2024, as well as a community engagement course in the fall of 2024. We'll have another evaluation of the SPORE Evidence Alliance at the end of 2024, and then a sustainability workshop in late 2024 to early 2025. So just to let everyone know that these are some upcoming engagements and events that we will probably be reaching out to many of you for your help with, as well as for your participation in.